If I am hospitalized, I'm going to have that exposure as it relates to copays, not co-insurance. You can buy a hospital indemnity plan on what hospital indemnity plan looks like.
Realistically, what you're going to have is a policy. So it's a separate policy from your Medicare Advantage. And you would pretty much buy it in conjunction with your Medicare Advantage, but it's through a separate carrier altogether, separate purchase onto its own. The main thing that you're going to have is a plan that's really going to help to fill in some of those gaps that you're going to have on your plan that might be causing you that heartburn or that anxiety. Because, the reality is this: when you kind of look at your out-of-pocket maximum, and when we have this conversation with a lot of people, we pretty much run through as far as what's going to be the way that you get to your out-of-pocket maximum. Really, at the end of the day, is going to be a lot, and I mean a lot, of copays.
Hello, Michael.
Hello, Brad.
Episode 13 of the Brad and Mike Show.
Woohoo!
Oh, I know, 13.
Lucky number 13.
That's right. And it's Friday.
It
So
is.
how about that?
My 13th birthday was on a Friday the 13th.
Really?
It was, yeah.
Well, that's got to be lucky. Did you have a good day? Do you remember?
I did. Yeah.
All right, outstanding. Well, it's hard to remember what you did on the 13th birthday. I myself played poker with my dad, but
did you win?
Yeah, I don't remember if I won or not, but they did let me take let me take a sip of beer. I do remember that. Yeah, that was pretty cool.
Very cool.
Yeah.
Well, happy birthday. Belated.
Yeah. That was quite a few years ago.
Yeah.
So today's podcast, what we're going to talk about are hospital indemnity plans and how they pair up with Medicare Advantage plans. And you don't necessarily need them with Medicare Supplement. You could still purchase them. There's no they're indemnity style plans, which means that it's an agreement between you and the carrier that if X happens, they pay Y.
Yep.
Specifically tailored for hospitalization.
Yep. Most people really, especially when it kind of comes to, a Medicare Advantage plan. I know that when we're talking to a lot of people, they take a look, and some of the concerns that they always have are going to be specific to, I got an out-of-pocket exposure of X number of dollars. But the real big one that they always look at first and foremost is going to be that copay per day for being in the hospital and then for outpatient surgery.
That's correct.
And that's always one of the downsides that people see in some circumstances, especially when they're looking at plans that may be a zero premium plan or a very low premium plan. Is that we've always said before, hey, look, you're either paying the insurance carrier or you're going to be paying the doctor.
Nothing's free.
Nothing's free.
Yeah.
So with that being the case, when they're in some cases on a zero premium, because that may be the most affordable plan for them, the downside might be is that they're going to have a lot more exposure than somebody that may be paying, let's say, $50 or $100 per month, or they might be on a med sup plan.
Right.
Which, when that happens to be the case, their exposure is much less. But when you increase that exposure, that's always where you start to see a little bit of anxiety from those people. And they're like, what do I do in this case?
Well, so let's put this in context. So I myself purchased, as I aged in, as I mentioned in our last podcast, a Medicare Advantage plan. And it was the right fit for me. I know what my out-of-pocket exposure is, as you mentioned, as relates to hospitalization.
Yep.
If I'm hospitalized, days 1 through 6, and then there's exposure there. And then, of course, for surgery. And a lot of times when you see what that maximum out-of-pocket exposure is on a Medicare Advantage plan, a big chunk of that exposure is directly correlated to hospitalization,
Correct.
surgeries, and then, of course, skilled nursing.
Yep.
These hospital indemnity plans address that risk. You have some exposure and you can offset. So let's put this in context as it relates to a Medicare supplement, and that Medicare supplement has a monthly premium up front, right?
Yep.
Medicare Advantage plan could be a zero premium plan, like the plan that I purchased is a zero premium plan. I don't have anything. It's just that if I am hospitalized, I'm going to have that exposure as it relates to copays, not co-insurance. Copays.
Yep.
Right. So, you can buy a hospital indemnity plan. And let's talk about what hospital indemnity plan looks like.
Okay. So realistically, what you're going to have is a policy. So it's a separate policy from your Medicare Advantage. So this would be something that you would
It's a standalone plan.
Standalone.
Separate from Medicare.
Correct. And you would pretty much buy it in conjunction with your Medicare Advantage, but it's through a separate carrier altogether, separate purchase onto its own. The main thing that you're going to have is a plan that's really going to help to fill in some of those gaps that you're going to have
Right.
on your plan that might be causing you that heartburn or that anxiety. Because, the reality is this: when you kind of look at your out-of-pocket maximum, and when we have this conversation with a lot of people, we pretty much run through as far as what's going to be the way that you get to your out-of-pocket maximum, which at the end of the day is going to be a lot, and I mean a lot of copays are going to get you there.
Right. And we've got a few things that we can list up where the most common exposure is related to.
Correct.
But so can I customize, do you think, my hospital indemnity plan to fit my specific Medicare Advantage plan? Why, yes, you can.
Exactly. And that's why these are very powerful from these different
they really
carriers, because the main thing that you're going to have is from one plan to another through carrier to carrier on a Medicare Advantage, you will have different copays associated with how those are laid out. And what I say that is this: some carriers actually have a copay for your days in the hospital, which just might be days 1 through 5.
Mhm.
Some might be days 1 through 7. So if you can't customize that, you might be, let's just say, paying too much for the extra benefits that you may never use.
Yeah.
So from that perspective, it always makes the most sense for somebody to look at what their Medicare Advantage plan is, and then obviously to the hospital indemnity plan, how that kind of fits together. So if you kind of think of it, the old terminology, hand in glove. So you want them to fit very nicely together. You don't want a baggy hospital indemnity plan.
No. An ill-fitting hospital indemnity plan is unseemly and unsightly.
That is correct.
Yes. So that said, as we mentioned, you can customize these to fit, as you mentioned, like a glove to your existing Medicare Advantage plan. Some of the questions that we're going to ask, and earlier in the last podcast, we talked about when you call us at 734-259-6750. I got to throw that in there. When you give us a call and we're having this initial conversation about what makes best sense for you in terms of, if you're aging into Medicare, whether you're a supplement or Advantage plan, and we talk about Advantage plans, if you do settle in on a plan, and we can now narrow it down and illustrate to you where your exposure lies. And then from there, what a hospital indemnity plan might look like to help offset that exposure.
So let's use you, for example.
Sure.
You just signed up for a Medicare Advantage program. So with that, your plan's going to have a copay per day in the hospital.
That's correct.
How much is your copay, would you say, on your plan?
My plan is $325, I believe.
$325.
Yes.
So you could buy a hospital indemnity plan if you wanted to cover that $325 per day. So if you're in the hospital for 3 days, you would technically, just from that copay alone, so no other office, doctor's visits, that type of thing, you're looking at $975.
That's correct.
If my math is correct, because I'm not good at math. With that being the case, if you don't have $975 set aside, maybe you've been saving up and you have it sitting on the sidelines, maybe you had an HSA before and you've stuck that money aside for that. This is where a hospital indemnity plan could come into play, where you could set it up to pay $325 each day that you're in the hospital, thereby mitigating that amount that you'd have to come out of pocket for. And so I always look at it in these ways to say, okay, you can either have the money set aside for yourself if you're diligent in that way, or at the same time, you might be on a fixed budget. And you know what? You're not going to have those dollars to be utilized or be sitting on the sidelines, but a hospital indemnity program could come into play.
Yeah.
Now, along those lines, the other big thing is cost. People are always like, well, do these cost a whole lot?
That's what I was going to drive at. Everyone always wants to know, what does it cost? What does it cost? And what if I have a pre-existing condition? What if I've got something that you might think that would preclude you from purchasing the plan?
Yep. So 2 things. Cost-wise is going to be based on your current age when you're entering into the program.
Correct.
And then what type of benefits are going to be built into your plan. So back to a little bit earlier, you had said, could it be a day in the hospital, outpatient surgery, skilled nursing? You can add on ambulance benefits. So there's different benefits that you can add on. But in most cases, what people will see is it might be
it's the hospital.
That might be $30 a month to cover something like that.
And it's a nominal, when you consider what hospital indemnity plan costs and you add that to a zero premium Medicare Advantage plan, you're still way ahead than if you bought a Medicare supplement. And I'm not disparaging Medicare supplements, and I'm not saying one's better than the other.
Correct.
I'm saying that what makes sense for you for people most often is when we work the math.
Correct.
And really that's what it comes down to.
And that's the key. But I want to go back to, we talked a little bit about cost, but then also as far as pre-existing conditions.
Right.
And then also plans will also have guarantee issue capabilities.
That's correct.
So unlike where you go into a Medicare supplement and you have to purchase the program right away to have guaranteed issue rights, a lot of the carriers actually have fairly large spans of where you can purchase the policy guaranteed issue. Mm-hmm. So for instance, they might be from 64 and a half through 70. So with that being the case, you might be 67, 68, still pick up the program.
Yep.
However,
guaranteed issue.
Well, guaranteed issue, but there might be pre-existing. So some of the policies, and it always depends on the carrier.
It does depend on the carrier.
But you might have something like a 6-month pre-existing condition clause, which basically means, hey, for the first 6 months, we're not going to cover this, but after 6 months, we will. So if you know that you're going to have that hip replacement or something's got to go on and you're going to have surgery and you're going to be in the hospital for a number of days, well, if you can purchase the policy, go 6 months without it, whatever that situation might be, you can eliminate that pre-existing condition and have that scenario completely covered at that point. So it bears the whole conversation, kind of back to what we've been talking about, is when you give us a call here at the office or hit our website at www.bradandmike.com, you can see the information, but at the same time, we can talk to you about this and show you how they can work in conjunction with one another. Now, is it necessary that you have it? No.
Nope.
But along those lines, it's always good to know that, hey, you know what? Let me make the choice, whether or not this makes sense for me.
And to your point, Michael, our job is to ask you a lot of questions and to ascertain where your risk is and what your current circumstances in regards to your health. All those things factor in. Ultimately, our job is to provide you with all the information so you can make an informed decision. A hospital indemnity plan makes a lot of sense for people. I can tell you this as it relates to, we'll say we're talking about getting your knees done or your hips done.
Yep.
And I'm of the age now where I've got contemporaries, friends who are getting their knees and their hips done.
They're creaking along.
And the crazy thing is like everybody I know who's had their knee done waits until that pain is just intolerable. Sure. And then they're like, finally, I got to get my knee done. I just can't stand the pain anymore. And it seems like that's the way it works. But that's not to say that you can't plan for it. And that's where I was going with this. You can kind of plan for all this and you can put yourself on a timeline. Again, everybody knows as you get older and you wake up in the morning, you're a little stiff. You know if your knee's jacked up. You know, eventually you're going to consult with your physician and he's going to say, I don't know about that knee.
Bone on bone, baby.
They're going to try the cortisone shots. They're going to try all the stuff. And finally they're going to say, you know what, just going to have to get your knee replaced.
Yep.
You know, so knowing that there's a way for you to plan for that exposure, that's why I really like these hospital plans a lot.
Well, they really do. I mean, just kind of sum it all up, they really help you mitigate some of your exposure that you would have with your Medicare Advantage plan. Mm-hmm. Because when you're looking at a Medicare Advantage plan and you're like, hey, look, I see this plan, it's zero premium, but man, that copay for being in the hospital, that's pretty big. And then you might look further down the line with the, different plans that they have. And it's like, wow, that's a much better copay for, being in the hospital because it's lower, but then you see a premium attached to it. Maybe that premium's $100 and you're like, I don't want to come out of pocket $100. And that's where these hospital indemnity plans can really help you out because there'll be less premium in many circumstances, depending on your age, than actually going up a level or two within a certain Medicare Advantage plan with the carrier. Correct. But it always comes back down to asking questions, looking at the plans, making sure you figure out what's right for you, because that's going to be the key. I mean, everybody's going to be different. Your needs are different than my needs and mine are different than yours and vice versa from that regard. But when you get down to it, that's where these programs have their worth. And it's worth at least the conversation if it is something that does resonate with you to have with us.
And just so you know, you can customize these plans. There's a lot of different riders you can put. You can put a skilled nursing rider, an ambulance benefit rider, outpatient therapy rider. There's a lot of riders that you can add. Lump sum cancer.
You need therapy.
Yes. Wow. Indeed. So give us a call. And ultimately, it comes down to that. Just give us a call, and we'll walk you through everything, give you all the information so that you can make an informed decision.
Sounds like a plan.
All right.
Sounds good.
Well, hey, thanks for tuning in to episode 13 of the Brad and Mike Show. We wish you a good day, a happy Friday, and
make sure you like and subscribe if you're watching this on YouTube.
Yeah, if you're liking it on YouTube. And by the way, we did pass a milestone, which is kind of crazy. We had 50, what'd they say, 50 views?
Downloads.
50 downloads, which is, hey, we're figuring this out as we go. And that 50 download mark, I don't know really in context how that means. I'm sure Joe Rogan has a lot more downloads, but I like to think that our 50's a good place to start.
It sure is. So, well, good enough. Well, thanks everyone. Appreciate your time, and we'll see you next time on the Brad and Mike Show.